Hi everyone, welcome back to my channel Peer T-Test. In this section, we will learn how to analyze before and after clinical data using statistical method in SPSS. In clinical research, we often measure outcomes before and after treatment. For example, blood pressure before and after medication to test whether the treatment had a significant effect. We use the peer t-test. We use a peer t-test when the same participants are measured before and after treatment. Data is continuous, observations are dependent. For example, weight before and after diet therapy. A peer t-test is a statistical test used to compare the means of two related groups. These groups are dependent, meaning the same subjects are measured twice. The peer t-test has some important assumptions. Data should be continuous. Observation must be paired. Difference should be normally distributed. No extreme outliers. If these assumptions are violated, results may not be valid. Case Study 1. The blood pressure dilemma. Does the use of oral contraceptives significantly alter systolic blood pressure? We have 10 patients readings. Let's consider a clinical study. We want to evaluate the effect of new antihypertensive drug on systolic blood pressure. We measure blood pressure before the treatment and blood pressure after treatment. First, we enter our data and then find the differences of before treatment blood pressure and after treatment blood pressure. The normality assumptions hypothesis is difference data follow normally distributed and alternative data do not follow the normal distribution. For a small sample n is equal to 10, rely exclusively on the Shapiro-Wilk test statistics. The process to a parametric t-test use Shapiro-Wilk p-value must land in the safe zone. The safe zone is running the Shapiro-Wilk diagnostic. First, go to Analyze Descriptive Statistics and Explore. In Explore, move Dependent List Difference Variable and press the Plot button and check Normality Plots with Test and press Continue OK button. The results of Shapiro-Wilk is 0.428. Both examples is greater than 0.05. The normal distribution assumption is passed. The hypothesis steps: Zone 1 statement of hypothesis, Zone 2 significance level, Zone 3 test selection, paired sample t-test, Zone 4 computation, Zone 5 critical region, and Zone 6 final conclusion. This standardized 6 steps framework will evaluate our two incoming clinical trials. Step 3: Executing the compare means functions. The research question is: does the drug significantly reduce blood pressure in patients? Go to Analyze, Compare Means, and Paired Sample T-Test. Move in Paired Sample T-Test for blood pressure before the use of oral contraceptive and blood pressure after the use of oral contraceptive. The objective of this study is compare mean blood pressure before and after use of oral contraceptive treatment. Example Case 1 Outcome. The first step is hypothesis test statement. Null hypothesis is no differences in mean blood pressure and alternative differences in mean blood pressure. Step 2 level of significance alpha is equal to 0.05. Step 3 test statistics paired sample t-test. Step 4 the calculation mean difference is equal to 4.5 and the p-value of paired sample t-test is 0.009. Step 5 is critical region. Our p-value is less than 0.05, so we reject our null hypothesis, and the conclusion is since p-value is less than alpha is equal to 0.05, we reject our h naught. There is a statistically significant difference in mean blood pressure before and after oral contraceptive use. Example case study 2: the tumor volume audit. Do tumor volume measurements significantly differ when recorded by two independent doctors under similar conditions? We have 10 observations. Case 2 Outcomes. Insufficient evidence for difference. The first step is hypothesis statement. Null hypothesis is no difference in mean tumor volume, and alternative hypothesis difference in mean tumor volume. Step 2 is level of significance alpha is equal to 0.05. Step 3 is test statistics. Paired sample t-test was used. Step 4 the calculation absolute mean difference is equal to 0.37 and the p-value is 0.511. Step 5 our p-value is greater than 0.05, so we fail to reject null hypothesis, and conclusion is there is no significant difference in tumor volume measurement between the two doctors. Always report the mean alongside its standard deviation, mean plus minus standard deviation. Thank you for watching. If you found this lecture helpful, please like, share, and subscribe for more biostatistics content.